So let's go around. Start with Ish.
Yeah.
Introduce yourself. First name, background, your specialty, how many years practicing,
Yeah.
and how long it evolved.
So my name is Ishtvan. I go by Ish, and I've been a PT for 14 years, almost, and I've been working mainly in orthopedics. That's my main bread and butter, and did a bit of acute care, which I enjoyed. It wasn't for me, and did a lot of mainly private practice. Did a bit of corporate work as well, a couple of years, and I've been with Evolve for almost 2 years now.
Good. Specialties? Do you enjoy?
Mainly musculoskeletal, and then in the realm of orthopedics, I have some extensive training in MDT, which is the Mackenzie, they call it MDT now, and manual therapy in different schools between Maitland, manipulations, a little bit of Mulligan. So those are my interests. And then a little bit of male pelvic health, just the basics through bike fitting, and that's, I think, the main ones.
So bike fitting, male
Bike
pelvic
fitting,
health,
yeah.
spinal manipulation,
Yes.
with 3 or 4 different schools or approaches to that.
Yeah.
that
Dabble,
discipline.
little bit everything. I know.
Yeah.
Yeah. A lot of tricks in the bags.
That's good. And now diving into vestibular,
Yeah, it's my new interest.
your new hobby. Cool. Good. Emily,
Yes.
welcome to Evolve.
My name is Emily. I have been a physical therapist for 12 years, and I joined Evolve 4 months ago, I think. Yeah. And I have worked in orthopedics the whole time, outpatient orthopedics. I enjoy all of it. And yeah, special interests. I do some prenatal, postpartum rehab. I enjoy working with the older folks, geriatrics. And I am also trying to learn more about vestibular.
And more recently, another round of prenatal, postnatal
You mean with
care this weekend, right?
Yes.
Yeah.
Oh yeah. And I'm learning more all the time in women's health and pelvic floor, and yeah, lots of good stuff.
Cool. Jenny.
I am
PT number, what were you, PT number 2? Yes.
yes,
With Evolve.
at Bethany.
Yeah.
You can't count Sherwood.
Yeah.
I have been a PT for 7 years. Of the 7, 4 have been here at Evolve. So it's been a long time, it feels like.
More than half.
that we have evolved.
Yes.
My first 3 years were in New York in an outpatient practice. I've only worked in a private practice, orthopedic kind of setting, with a lot of collaboration with other professions such as chiropractors and massage and acupuncture. I have some training background in Pilates. I enjoy working on core stability and all that comes with it. So a lot of maybe low back pain kind of patients and prenatal and postpartum patients for recovery and getting ready to have a baby. What else? Yeah.
Good. Thank you. Laura?
I'm Laura. I have been a PT for almost 10 years this coming May. In my time, I've worked mainly in small to medium-sized orthopedic clinics. I've been at Evolve for the last 3.5 years, and I have I've pursued some extended training. I have my certified strength and conditioning specialist certificate, and then I also in 2021 took the test to be board certified in orthopedics. So I've been keeping that up. Specialties or my interests are probably working with youth athletes in terms of injury prevention, but also recovering from small ankle sprains to major injuries. And I'm growing in my interest in like the perimenopausal female and how the menopausal cycle phase can influence strength training in a woman's overall well-being.
All right. So
How long have you been with Evolve?
I've been with Evolve since its inception in 2017. So short story, I had a private practice out of state, moved to Oregon in 2016. And after literally the first day that I started that other practice, they sold. And the fact that they sold was like, okay, but then who they sold to was the, what we call the McDonald's of PT, just churn and burn. And so it wasn't something I was interested in continuing. So another director and I got together at that clinic and decided to create this that we have created. And we started in Sherwood in 2017. And then we opened up here in Bethany in December of 2020, kind of in the middle of the mess of the pandemic. And yeah, it's been good, and it continues to be good.
How many years have you been a PT?
I've been in PT for 28 years, Emily. 28 years, yes. A little bit longer than, a little bit longer than I realized, actually. It doesn't seem that long. It doesn't
and you're
seem
still
like
seeing
that.
patients.
And I'm still seeing patients.
Love it.
And
Not just in admin or
no,
up in the bureaucracy of it all.
I'm going to just keep grinding because,
In the clinic.
you know, I like, and I've said this to a couple of you, I think, but, you know, if you roll in here on Monday morning, you're like, it's Monday, but I don't always feel that way. I really don't. And on Friday, at the last patient, if it's like, oh, this is a tough one, or, oh, hey, guess what? We have extra time. You're my last one for the week. And I dig in, and it's still enjoyable. And if it wasn't, if I couldn't practice in the way I wanted to practice, because I've been there where you practice with techs, and you practice with aides, and you're churning and burning and just going round and round, that would not be fun. And I don't know that I'll keep practicing if that's what it has to turn into. But for as long as we can, we're going to keep doing it this way, because it's the right way and we enjoy it. I enjoy it. I think it's what gets patients better. I think it's what gives us professional job satisfaction.